Okay, so thank you. Welcome everyone for joining today. We're really excited to share the results of our Exploring Youth Vaping Cessation, an interview project today. My name is Julia Hartley and I am the PI Director of Operations for the Lung Association of Nova Scotia and Prince Edward Island. As many of you know, our organization has been working closely with Nova Scotia and a shared services agreement for the last few years. So we are excited to announce that we have officially merged together with Robert McDonald, who's on the call today, as our CEO. So we're really excited about this new organization, and you know, we have more information coming out soon about the merger that we plan to share, but this is our first webinar as the merged organization. So yeah, really excited. So the project we are presenting today is building upon other work that our organization has done over the last few years, such as our 2021 Youth and Young Adult Vaping Survey, our Youth Vaping Awareness Days, and our Youth Vaping Prevention Toolkit. So for this project, we really wanted to start looking at youth cessation, youth and young adult cessation. So, you know, we were very fortunate to have 2 nursing students join our project team as part of their community partnerships 3rd year class. These students have been extremely adaptable and were able to complete this project mostly virtually. I've been working hard on this project since January. So the speaker portion of our presentation will be recorded today. We plan to share the recording as well as our project report with those on the listserv this week, later this week. So as I said earlier, if you didn't receive our original invitation, please put your names in your emails in the chat so we can forward you our project report and our recording. We also ask that everyone mute themselves for the presentation portion, and then following the presentation, we plan to have a discussion that will not be recorded. So I'm going to turn it over to Walter and Grace, and they can get started.
All right, so hello everyone. I hope everyone can hear me well. My name is Grace Allen. I'm a 3rd year nursing student at UPI, and I'm joined with Walter.
Hi, Walter.
So like Julia said, we've been working on this vaping project for the last 3 months now for our community health 3rd year class. So I'm just going to begin with a little bit of an outline of how today's going to go. So we're going to start off with a little bit of an introduction about what the project's about, including our objectives and our purpose. We're going to talk a little bit about our target audience and our recruitment process, as well as our involvement with multiple social media platforms. We'll talk a little bit about the results from the participant interviews, as well as some quotes from the participants themselves. And then we will be concluding with a question and answer kind of discussion period at the end. Okay. So overall, this project was aimed at discovering and exploring the perspectives of youth and young adults on the island about vaping and quitting vaping. So our objectives overall were to better understand vaping from the perspectives of this demographic, so specifically ages 17 to 24, and how we can support them in their journey of becoming smoke-free. We also were working towards exploring factors that contributed to youth and young adults quitting successfully and better understanding that from their personal experiences with youth and young adults on PEI, as well as gathering relevant and current data on vaping on the island so that we can develop programs and services to help this demographic and provide them with the right support that they need. And lastly, to have a better support a positive behavior change in this community. So I just wanted to mention that for this project, it was funded through a Catalyst grant through the Department of Health and Wellness to help organizations like the Lung Association of Nova Scotia and PEI take initiatives to help outcomes such as fostering assisted mapping and skill building, increasing capacity for sustainable action on healthy living within communities. So for this project, the target audience was youth and young adults, specifically ages 17 to 24, who currently live on PEI and who have either successfully quit vaping or had made a quit attempt. I'm also just going to briefly mention, so our population was youth and young adults aged 17 to 24, and some challenges arose with connecting with individuals who were under the age of 18. So in order to include these participants in the data for this study, and the fact that we weren't unable to obtain parental consent for the youth under 18, as a lot of the participants that participated in this project, their parents were unaware that they were vaping, we decided to send out a survey that contained the same questions as the interview process. And so the participants of that survey could send us back their answers to the survey in a form of assent rather than consent.
All right, so working with that younger group of people, it is really important to be able to reach them in an effective way. So we did use social media as a great way to make a connection with them. So we were able to make some content posts and some advertisements that we could put on Instagram and Facebook, which are popular social media feeds that they subscribe to. And this is mostly to create an awareness of vaping cessation and vaping behavior on the island. But it was also a way for us to secure participants to be involved in the study by providing links on these ads or posts that would take them directly to a Google forum where they could fill out the form and sign up for a time to do the interview. We also reached out to other local social media accounts for assistance in sharing our posts to kind of broaden our reach, so to speak. So this is kind of just a little graphic visualization of some of the content that we posted. Just very simple. Some of them are very bright and colorful, grabs your attention, but we wanted it to be mainly a little bit of information, grab your attention quickly, know what we're talking about, and then also provide them with that link so that they could go to that Google form and sign up to participate. These are just a few examples of some of the different pages on Instagram that shared our post to their story. There's the 24 Strong, which is a dance studio, so there's a lot of youth involved in that as well. Innovation PEI, and the artistic director of the Confederation Center, so that's like the Arts and Culture Center downtown. And we also had some government support. As I said, the presenter of the Catalyst Grant was the Department of Health and Wellness here in PEI, and they were able to share our content as well on their Facebook page just to extend that reach, as we said before. So in using social media, it was very effective in being able to reach the youth of these ages that we're looking at. We did offer a $25 gift card as an incentive for completing the interview, which did, I believe, definitely help in gaining some participants. And we also, a big method of reaching these individuals was by using paid promotions on Instagram. So basically you can put money on it and make it almost like an advertisement, and you can put limiters and different parameters so that it's reaching the exact specific target audience. So that was very helpful in locating that very specific subgroup of people. This is just a slide showing some of the performance of the digital promotions that we had. You can see from Instagram, it reached over 11,000 people in our first run of the ad. So it was very effective in reaching the people that we wanted it to see. And again, we have just a graph from the Google forum. We had asked how they had heard about the opportunity when they were signing up for it. And over, definitely 68% of them said Instagram was the main reason that they knew about this opportunity, through the ad or through visiting the Instagram page. Other things would be like there were posts on Facebook and word of mouth through family and friends who may very well have seen it through Instagram as well. So overall, the Instagram ads were very effective in reaching the demographic.
Okay, so to get participants to sign up for the interview and to have a scheduled interview time, and to gain a little bit of insight for us into the potential participants that we're going to be interviewing, we created this Google forum that was sent out via our social media ads, like Walter was explaining, for individuals of this demographic to sign up. So the Google forum touched on some brief topics in order to ensure that the participants signing up met the required criteria of the project. So this included a brief explanation on vaping behavior. So do you vape currently, or have you tried to quit? where on Prince Edward Island you're located, so in Queens, Prince, or Kings County, and how they would like to conduct the interview. So we gave them a little bit of options because a lot of people are working virtually. So we gave them the option to do a Zoom video, a Zoom audio call, or to give us a phone call. And we also asked them if they were comfortable with sharing the results of the interview, either that be their video and their audio or just their audio clips. So all participants that were okay with sharing their video audio were sent a consent form to return back to us that told us that they're okay with having their interview recorded and to be posted on publications such as this presentation. So this is another visual representation that came directly from our Google Forum that just represents that although the criteria for the project was that you either quit successfully or had made a quit attempt, over half of the participants that signed up are still currently vaping because they had an unsuccessful quit attempt, which represented that we did need this project to be done to foster further supports and services. And again, this is another visual representation that we included from the Google Forum that just kind of shows the age distribution of the participants that signed up. And as you can see, majority of the individuals that signed up for this interview were over the age of 18. So the next two slides are a list of the questions that we asked during the vaping interviews. So the questions were divided into 3 sections, beginning with a little bit about the vaping history of the participants. Then it got into a little bit of questions about how financials played a part in their vaping behavior and habits, and then a little bit about their quitting, so if they made a quit attempt or how they successfully quit. And then we finished off with some questions about what they would like to see in the future. And the development of the question list for the interviews was in partnership with the Chief Public Health Office Tobacco Control Coordinator. And then our question list was adapted from the set of questions used in the PEI smoking cessation evaluation. And I'm just going to add that each participant interview that we conducted was around 25 to 30 minutes long, either through the Zoom audio, video, or phone call. So now moving on to a little bit about the results of the interviews. So when we were discussing with the youth and young adults in the interviews, some of their motivations for vaping, it was represented, the common themes were social norms amongst their friends, how accessible it was and easy to conceal. We also asked what type of vaping product they used. So that was either a tank system or a pod system or like a box system. So the most common type of vaping system that they used among this audience was a pod system. And when we asked about where the most common places the vaping products were purchased, tobacco and vape stores were very common, as well as purchasing the products online, as the age restriction pages on the online vaping store websites don't verify age and are easily bypassed. This slide goes into a little bit about moving on from the motivations of why the youth and young adults are vaping. So the social norms amongst friends, this is supported with evidence, as it was found that social norms and social interactions with peer groups was a key factor in the update and use of e-cigarettes, as well as the easier to purchase. So these findings were also supported by the Smoke-Free Nova Scotia 2019 study who found that 33% of youth who vape ages 16 to 18 report retail locations in Nova Scotia as the most common frequent outlet for accessibility for vaping products.
Okay. And then so after learning about a bit of their history with their vaping, we wanted to get into maybe some of the quitting attempts that they had had. So we did ask questions along the lines of like, what are your motivations for making a quit attempt in the first place? And a lot of the participants cited health benefits, knowing or believing that if they were to reduce or to quit the use of their vape, that they would have better lung health. Another big one was financial benefits. A lot of the people who we interviewed had said that they were spending quite a bit on vaping and that it was becoming a financial burden. And then, of course, they believe that they would have less cravings and less stress associated with having to the vape all the time. And then the number of quit attempts, multiple times were, well, the participants had said that they had quit multiple times, sometimes upwards of 5 or 6 times. So that shows, you know, the fact that people are trying to quit, but they're not really succeeding in their quit attempts all the time. So there's definitely like that need. It's showing the need again. And some of the challenges to quit while they were trying to attempt to quit, it again goes back to that social norm among friends. If it's always in your immediate vicinity or in your environment, it's really hard to escape sometimes. And there's triggers for wanting to, you know, participate in that activity. There's also mental health. A lot of the participants had said things like they would feel really anxious if they couldn't vape, or feeling additional stress, which meant that they wanted to go back to their vape, those kinds of coping mechanisms to deal with those situations. And also, again, they were feeling cravings, which was making it harder for them to remain vape free. We also had asked if they had tried any nicotine replacement therapies, which most of them said they had not tried. And they cited the reason for that being that it was too expensive, or that they just didn't have access because of their age to those products. And then some said that they had tried the gum, but it didn't end up working for those individuals. Factors that help them stay vape free. A lot of people, again, talked about limiting their exposure or changing their environment so that they weren't around it all the time. And also physical activity, keeping yourself physically active, and even sometimes too busy to participate in vaping or distracted from it. They said that that was really helpful. And then asking about the supports that they were using while they were attempting to make those quit attempts. A lot of people said that social support, either through friends or family or partners, was really beneficial. A lot of people said the opposite as well, that even though social support can be really beneficial, it is sometimes those social supports who are also the ones that are vaping, and it's not really beneficial to you. So that one kind of went either way. And a lot of the participants also said that they just used their own self-motivation and their own determination to try to, you know, get over that hump and really stay vape free. This is just one quote that was from one of the interviews I found really powerful, talking about finding your reason to quit. So the participant said, "You need to find your reason if you're going to quit. Everyone I know that said, 'I'm quitting,' didn't end up quitting. Unless it's, 'I'm quitting because I don't have the money for it,' or 'because I want to play softball,' things like that, that kind of reason." So definitely find your reason is number one, which I found really important to bring forward. And then asking about their day-to-day health and their day-to-day life in general, how has vaping affected those parts of their lives? And 3 of the main categories were physical health. A lot of people had said they had difficulty breathing, some congestion, some chest infections in some cases, some shortness of breath, and of course, like decreased stamina and energy for doing some of these physical activities that they usually would be doing. Another one, again, was that financial burden. That was a really reoccurring theme. And then mental health. So they were experiencing a lot of mood changes. They were becoming more irritable or cranky. And they also did have those increased levels of anxiety and stress in their day-to-day lives.
So just moving on from what Walter said as well with the vaping and mental health. So one of the most common themes amongst the participants we spoke to was vaping and mental health. So the research does show that vaping increases anxiety as well as the use of nicotine in general. So this was well connected with the feedback that we got back from the interviews, as many of the participants in the interviews expressed having anxiety and increased stress levels due to their vaping habits and behaviors. And this was another quote that came directly from a participant in the interview, and it says, "We need more mental health resources around vaping, as a lot of people vape to deal with anxiety and depression and don't know any healthier ways." So due to the pandemic, we thought it would be very effective to include a question about the effects of vaping during the pandemic. So in results, more than half of the participants that we interviewed about the effects of their vaping behavior in the pandemic said that due to the pandemic, it has increased their vape use. And some of the reasons for that were due to the increased levels of stress, which led them to go and vape, the more time they had spent at home, and also due to the lack of mental health resources due to the pandemic, as a lot of the individuals we spoke to would turn to school resources, school counselors, therapists that weren't available when school was not happening in person. So a lot of them would turn to vaping. So the need for support. So the data that have been collected surely indicated that we needed supports and services for this demographic to help them assist with quitting vaping. So we asked the participants if they knew of the current resources for vaping cessation, and 99% of them were not aware of any services or supports available on the island. So this really showed that we needed to make the services that are available on the island more known to this demographic. And this was also another quote from the participant interview that says, "I think this research is really important, actually. At my age, I feel like it was a lot easier for me to quit. But I think at 16, when you're a lot more vulnerable, it's very easy to become addicted to anything. Yeah, I think it's really important that you guys are doing this."
And yeah, that just shows the vulnerability that youth presents and kind of illustrates that need for tailoring some of these cessation programs toward that group, which kind of came forward when we were asking about what we want to see, which is the next slide. We'll come back to that. One of the things we did ask toward the end of the interviews was any advice from the participants that they would share with others who might be having difficulties in making quit attempts or in following through with those quit attempts. So a lot of them said being informed or educating yourself on the risks of vaping, distance yourself from the settings where vaping occurs, using relaxation techniques like deep breathing and journaling and meditation, definitely seeking mental health supports and resources, and beginning with gradually lowering nicotine and the percentage of your vape, which would help in reducing that harm and hopefully in leading to a complete cessation in the future. So when we asked them about what they would like to see in terms of resources and programs available, a lot of people had said more education, again, more education even in schools and in public for this demographic of younger youth adults and youth, surrounding the risks and vaping effects and how to quit, as well as support groups and counseling, which again, they said that they would rather it be specific to their age group rather than kind of joining in a support group that was open to all ages where they may not be able to relate to some of the older population who may be there. They want it tailored to their own age group. And again, online resources, as we noticed, and even just trying to get participants for this study, online resources are crucial in this age group. So having online resources in terms of support groups and counseling might work as well. They also said things like a vaping action plan where you could plan with your healthcare provider about how you want to go about your quit attempt and different things like resources you can contact or look for support during your attempt. Mental health resources as well. And a lot of people have said that testimony and success stories they believed would be really beneficial, so that you know that other people have gone through similar situations and other people have been successful. So, you know, if you're in the middle of a quit attempt and you're feeling like it's all for naught, then you can have those testimonies that may give you that extra determination and say, you know, if they can do it, I can too. So we're going to pass it back over to Julia, and she's going to talk about maybe what comes next from participating in this research.
Thanks, Walter and Grace. That was a really great presentation. So I'm just going to share just quickly kind of what's next for our organization. We feel that this project was an excellent first step in helping to bring the voices of youth and young adults to the table in our discussions about youth vaping. We were very impressed with how open the participants we interviewed were with sharing their personal experiences, and just the depth of the data, just the depth of the understanding that they had about, what programs and services we should have on the island and what they'd like to see. So going forward, our organization plans to, better understand the experiences of youth and young adults on PEI who were successful in quitting vaping. We want to better understand what supports were really crucial in them being successful with that quit attempt. We plan to continue to advocate for evidence-based programs and services for youth vaping on PEI. From this project, we also plan to share some of the testimonials that our participants shared with us via social media, as well as other avenues. That was kind of something that sort of stuck out to during this project, that youth like to hear the experiences of others, but in words that are more appropriate for that demographic or how they like to hear it. So we're now going to play a short example of one of the social media reels that we created and promoted to youth and young adults on PEI. So as part of our Catalyst grant, we were able to do a paid promotion of this ad, and it reached over 2,600 people. Actually, that was targeted directly at youth and young adults aged 13 to 24 through paid Instagram promotion. We'll just watch that.
I definitely feel the effects from vaping on my breathing. I can't run the way I used to be able to. I can't really exert any physical, I can't do anything really without feeling like I'm I obviously was not like that beforehand. So I do find exercise is a lot harder, and it just makes me not really want to do it. Going for a hike, I went to Bonshaw Hills, I just could barely breathe while doing it. And I think that was a huge reason why I wanted to quit, because I like going out for runs, I like walking, and I felt like I couldn't enjoy that anymore.
Thanks for sharing. Okay, so this is the wrapping up of the presentation. I'm just going to close the recording now.